Hello, my name is Leanne and welcome to Blackboard Pharmacology. Today we're going to look at what is angina and what are some of the treatment options for angina. And this will include your nitrates, calcium channel blockers, and the beta blockers. So the main symptom is chest pains. And this happens due to metabolic waste products that form after you have insufficient myocardial oxygen supply. So this is going to happen because of one or two reasons. The first reason will be there is a blood flow restriction, and the second reason is vasospasms. The reason for this blood flow restriction is usually due to blood clots that form in the presence of an atherosclerotic plaque. And the vasospasms is due to endothelial dysfunction, which leads to impaired vasodilatation. It's also important to note that angina isn't always associated with pains, but it is mostly. Let's first look at how smooth muscles relax and contract. And the reason why we are looking at the relaxation and the contraction of smooth muscles is we want to cause vasodilatation in the veins to decrease the resistance in the arteries. So how does contraction happen? If this is a zoom in of the transmembrane of a small muscle cell that's located inside the veins, it's going to need an influx of calcium ions. As soon as enough calcium ions enters the cell, an enzyme called myosin light chain kinase is going to be activated. And this activation is going to enable myosin to interact with actin. This mechanism also explains why calcium channel blockers is going to be a good treatment option in this case. Looking at the relaxation of a smooth muscle, exactly the opposite happens. As soon as there's an increase in cyclic AMP, we are going to get the movement of calcium ions outside of the cell. When calcium exits the cell, there's going to be deactivation of this enzyme, myosin light chain kinase. And thus, myosin won't be able to interact with actin anymore, and we're going to get a smooth muscle relaxation. Medications that work at this mechanism will be your beta-2 agonists that's used in asthma treatment, although it's not relevant for the treatment of angina. And also your PDE inhibitors like sildenafil. But we will have a look into that mechanism a little bit later because it's somewhat more complex. I just wanted to highlight how smooth muscles relax and contract for us to understand the pathophysiology of angina and why we are using certain drugs to treat angina. What will our treatment goals be if we want to treat angina? First, this blood flow. We want to increase blood flow so there's no blood flow restriction anymore. Why do we want to do this? This is going to increase the oxygen delivery and decrease the oxygen demand by the muscles. The other treatment goal in this case is going to be statins because blood clots are usually formed in the presence of an atherosclerotic plaque, and that's why we're going to need the statins. If there's a vasospasm involved, the main treatment is going to be nitrates because nitrates is your most potent vasodilators, but also beta blockers and calcium channel blockers. As said previously, we want to induce smooth muscle relaxation, and let's look at how drugs can achieve that effect. The first one is going to be an increase in cyclic GMP. This is going to prevent actin and myosin from interacting. Main reason for this is dephosphorylation. Examples of drugs that work in this manner will be your nitrates and your nitroprusides. The second mechanism is going to be a decrease in intracellular calcium. And drugs that work in this manner is going to be beta blockers and calcium channel blockers. The third mechanism is going to be to stabilize or prevent depolarization. When this happens, there's going to be an increase in cyclic GMP. Examples of drugs that work in this way is going to be minoxidil. The fourth mechanism is going to be to increase cyclic AMP. And this is going to cause deactivation of that very important enzyme called the myosin light chain kinase. Let's start with the nitrates. So the most common group is going to be nitroglycerin. And for interest's sake, nitroglycerin is also used to manufacture dynamite, although the medication are luckily not explosive. Okay. This medication is mostly given in a sublingual form. And the reason for this is due to the liver containing high concentrations of the enzyme that breaks down the drug, and secondly, for that fast effect. But unfortunately, as we know, any drug with a fast onset of action is not going to have a long duration of action, so it's usually given in combination with the oral forms. Another important thing to note is that tachyphylaxis can occur when using this drug. Tachyphylaxis basically means that you build up a tolerance for the effect of the drug and that you need a higher dosage to get to the same effect that you previously got with a smaller dosage. Quite interesting how they discovered this tachyphylaxis effect is there was a group of factory workers that worked with these molecules, and they complained of a Monday headache. So on a Monday and a Tuesday, they complained of having a headache and being dizzy, which is one of the main side effects of this drug. And then by Wednesday and Thursday and Friday, everything was kind of going better and they were all able to do their jobs and stuff. And so on the weekends, they were totally fine. But then come Monday again, the headache will reappear. And this means that during that weekend break, the tolerance has decreased for the drug. So as soon as they get exposed on Monday again, they will experience the headache. But when they get exposed for Monday and Tuesday, the tolerance develops, and thus the same amount of drug that gave the headache on a Monday is not going to give a headache anymore on the Wednesday, because the body is getting used to the action of the drug and it's not getting triggered as heavily as when it first got introduced to the molecule. Alright, so when we look at the mechanism of action of this drug, step 1, this drug needs to be activated to its active form, which is nitric oxide. Nitric oxide then combines with a heme group and activates an enzyme to increase the cyclic GMP. Also note that prostaglandin E and prostacyclins plays a role here. After the increase in cyclic GMP, we're going to see dephosphorylation of the myosin light chains, and this will lead to hyperpolarization. I like to remember the side effects of this drug with a quite relevant mnemonic, and the mnemonic is hot. So because these drugs increase blood flow due to vasodilatation, you get kind of hot when you use it, so that's how you can easily remember the side effects. So the first H will stand for headache, a throbbing headache, which is caused by the dilatation of the large arteries. The second one is going to be orthostatic hypotension. And the last side effect, tachycardia. Okay, so let's look at some practical aspects of these drugs. And just as a recap, we are looking at the organic nitrates, and they act as vasodilators. The first group is the glyceryl trinitrate. The trade name of this is going to be Angina, and it's going to be a sublingual form. Alright, so the onset of action is going to be 1 to 3 minutes, and the duration of action is going to be only 30 to 60 minutes, which is very little. It comes in a 0.5 milligram. So you're going to take one of these tablets every 5 minutes, with a maximum of 3 tablets in 15 minutes. Then after that 15 minutes has passed, you can start again with 1 or 2 as needed. Alright, so common interactions with this medication is going to be alcohol, and secondly, sildenafil. Sildenafil is a PDE5 inhibitor. The side effects were already discussed in the previous slide, but let's quickly just recap them. So I don't know if many of you can remember my mnemonic, HOT, which is going to be describe the most frequent side effects, which is going to be headaches. And the previous slide we said orthostatic hypertension, which is just the same as posterior hypertension, and tachycardia. So what I just wanted to add is that posterior hypertension can be eased by elevation of legs, or to be in a sitting position when taking the drug. So maybe you can just like sit down and not stand up too quickly, or the elevation of legs. If the patient experiences blurred vision, they must immediately stop taking the tablets and must see their doctor again, because this can lead to more serious side effects. Okay, there is some special instructions for these drugs. Also, instructions that I feel is not very often given at a pharmacy. So the first one is going to be to keep it in the original container. A lot of old people like to put their medications in a Monday, Tuesday, Wednesday container, but the problem with these things are they are quite sensitive to environmental factors, so keep it in the original container. And the second special instruction is to discard after 60 days. Alright, so let's look at the next one. It's called Isosorbide dinitrate. And this one comes in a 5 milligram, a 10 milligram, and a 30 milligram. And it's also in sublingual. It comes also in a sublingual form. So you're going to use this medication for the relief or the prophylaxis of angina. Alright, and what's important for me in practice is to know that what is my maximum dose. The maximum dose is going to be 240 milligram per 24 hours. Sometimes the guidelines do change, but just to have an indication. For instance, a daily total dose of 1000 milligram, then you're going to know there's going to be red lights going off. You're going to know something is not right here. It's not to memorize every exact detail in the books, but it's just to have an indication and to have enough knowledge so that your gut feeling can guide you when there's something that is not correctly prescribed. Alright, and it's usually given as 5 to 20 milligram as a 6 to 8 hourly dose. But they do want you to rather go with the 8 hourly. This is because they call it a nitrate-free night. And the main reason for that is to prevent the tolerance that we spoke about earlier. Some advice that you can also give your patients is to take this drug with a glass of water. Like not only one sip, but take it with a whole glass of water. And also good to know that this drug is usually given in combination with hydralazine. Alright, so let's look at our last drug in the class of nitrates. And it's going to be Isosorbide mononitrate. So the The second one was dinitrate. And this one usually comes in a 20 milligram tablet. So the maximum daily dose for mononitrate is going to be 120 milligram a day, also in divided doses. And they sometimes say that to minimize headaches, you initiate the therapy gradually. For example, you start with 10 milligram BD for 2 days, and then 20 milligram a day for 2 days, and so on. All right. So very important to know also that these tablets are scored, so they can be broken, but they cannot be crushed or chewed, and they must also be taken with a glass of water. All right, and that's it for the nitrates. So the last two classes of drugs are calcium channel blockers and beta blockers, but we will have a look again at these drugs later on. So this will just be a quick discussion. Let's start with the calcium channel blockers. Alright, so these drugs do exactly as the name implies. It blocks calcium from entering the cell and thus decreasing the muscle tonus of the veins. If we look at verapamil, it's important to note that it has more effects on the heart and less on the veins. So it is a weaker vasodilator. In contrast to nifedipine, which has a greater effect on the peripheral veins than on the heart. One of the side effects of verapamil is constipation. And the contraindication is going to be patients using digoxin. This is because it also slows down the conduction of the heart, and thus the heart rate is slowed down, just as with digoxin. Nifedipine is less preferred due to its short half-life of only 4 hours. And some of the side effects do correspond with those of the nitrates, but one that differs from the group is peripheral edema. And this can be explained because nifedipine works more on the veins, just as the nitrates do. Alright, and that's it for the calcium channel blockers. So let's shortly discuss the beta blockers. Alright, so these drugs, they block the beta receptors on the heart from being stimulated. So they're going to decrease the cardiac output as well as the blood pressure. It's also quite often used for patients who had a recent myocardial infarction. Some of the very important contraindications is going to be patients with COPD, constructive pulmonary diseases, as well as diabetes. And the last contraindication is patients having peripheral vascular disease. Thanks for watching, and if you want to broaden your pharmacology knowledge, please check out some of my other videos. Goodbye.